just begin.
Hello everyone, I'm Dr. Lott from Acupuncture is My Life. I hope you've had a chance to go over the episodes on the different functions of the internal organs on this channel so that you can have some type of understanding of what I'm discussing when it comes to acupuncture and the internal organs and whether they are either yin or yang organs. Now, if you've had a chance to go over the basic functions of the heart episode on this channel, you'll remember that the functions of the heart in acupuncture govern the blood, it controls the blood vessels, the heart also manifests in the complexion, and it houses the mind. Now in this episode, since we're discussing the effects of the coronavirus and what it has on the heart, I will begin with discussing matters from a Western medical perspective, and then change over to discussing the effects of the coronavirus and what it has on the heart from an Eastern medical perspective, i.e., of course, acupuncture. Now, from a Western medical perspective, the coronavirus can possibly affect individuals with heart disease in a myriad of ways. Although the main target for this virus is the lungs, it can also affect the heart as well, with an emphasis on someone whose heart is in a diseased state because of the demands placed on the heart to move oxygenated blood throughout the body. Now, such stress on the heart can exacerbate problems for someone with congestive heart failure. Now, individuals with underlying heart problems tend to have a compromised immune system to some extent, especially those who are in the latter years of their lives. Now, an individual with accompanying medical conditions become that much more vulnerable to experiencing a fatal outcome when exposed to the coronavirus, especially if you're an individual with fatty buildup, i.e. plaque, in your arteries. Now, the inflammation response, i.e. vascular inflammation, myocarditis to this virus, only complicates blood circulation throughout the body, along with the destabilization of these plaques, which can put you at a high risk of a heart attack. Now, the two dominant cardiac issues related to coronavirus are abnormal heart rhythms and heart failure. Now, during severe infection of this virus, an individual's heart function may decrease due to systemic inflammatory response to this viral infection in the heart. Now, this is why if you were to develop chest pain and shortness of breath, you should seek medical attention by calling your healthcare provider, or if it's really bad, 911. Now, let's take a look at things from an acupuncture point of view. When it comes to how the coronavirus affects the heart function in Chinese medicine, in general, exterior pathogenic factors usually don't affect the heart directly. Instead, it affects the pericardium. Now, if you become confused from what I've just stated, please go back and view my episodes on the basic functions of the heart and the basic functions of the pericardium. Now, when it comes to the heart, the patient can develop scars or fibrotic tissue in the heart muscle or arteries as a result of this viral infection. They can experience symptoms of chest pain or heaviness, shortness of breath, fatigue, and arrhythmia. Now, these are symptoms that follow patterns such as heart qi deficiency, heart blood stasis, heart yang deficiency, and phlegm damp accumulation. Now, in Chinese medicine, let's start with heart qi deficiency. Now, clinical manifestations of heart qi deficiency are palpitations, shortness of breath, spontaneous sweating, tiredness, and so forth. Now, your tongue would appear as pale and your pulse would have an empty feel to it. Now, that's key here, that heart qi deficiency can affect the lungs and become associated with lung qi deficiency. This can be a problem for someone who's been infected with the coronavirus. Heart qi deficiency frequently leads to heart yang deficiency. Now, clinical manifestations of heart yang deficiency are palpitations, shortness of breath, tiredness, spontaneous sweating. But the difference between heart qi deficiency and heart yang deficiency is that with heart yang deficiency, there is a slight feeling of stuffiness or discomfort in the heart region. When a patient is diagnosed with heart yang deficiency, relative to viral infection, an acupuncturist in this case would focus on nurturing heart yang and clearing heart inflammation, i.e. heart cold damp, and toxic metabolic waste in the heart. We would look to remove blood stasis and nurture heart qi and blood and clear phlegm damp, as well as facilitate the removal of dissolved waste that have been carried to the muscles throughout blood circulation. For these wastes to remain in the muscle, you would experience symptoms like muscle weakness, body heaviness, headache, fatigue, etc. Now, these are some symptoms that can accompany the three main symptoms of coronavirus. Now, going back to the slight feeling of stuffiness in the chest region relative to heart yang deficiency, this would be tied to heart yang's inability to move qi in the chest, which an acupuncturist would diagnose as qi stagnation of the chest. Now, this is important because in Chinese medicine, heart yang deficiency can also lead to heart blood stasis, which can be fatal depending on its severity. Now, heart blood stasis from a Western medical perspective can be seen as angina pectoris or coronary heart disease. The clinical manifestations of heart blood stasis are palpitations, sharp stabbing pain in the chest, as well as constriction in the chest. Your tongue would show as purple, and your pulse would have a knotted feel to it. Now, these patterns in Chinese medicine relative to viral infection are closely tied to patients who develop scars or fibrotic tissue in the heart muscle or arteries as a result of viral infection. The similarity lies in symptoms of chest pain or heaviness, arrhythmia, shortness of breath, and fatigue. Now, in knowing this, a person with underlying heart problems should look to avoid contracting the coronavirus as best as possible. Now, please wash your hands as much as possible. Wear some type of face mask and try not to go outside. And if you do, try to return home as soon as possible. Now, once this pandemic passes, and it will, go see your nearest acupuncturist to discuss ways in which you can boost your immune system to live a healthier and longer life. And until next time, acupuncture is my life. What's yours?